My name is Mary Kretschmar. I used to weigh 280 pounds. I now weigh 160. And I went from a size 26 down to a size 8. Anybody who contemplates bariatric surgery, they've been that fat person. They've been that person that it gets on the bus or gets on the train, and as you walk past people, they keep scooting in because they don't want you to touch them. It's almost like you have a disease or something. And when you're there, when you're at a party or something, nobody really talks to you because it's like you melt into the woodwork. You would think, you weigh 300 pounds. How can you possibly melt into the woodwork? But you do. I have back problems. I'm an asthmatic. I could not breathe. My feet started to hurt. I couldn't get around as much anymore. I was really concerned. And at that time, my children were 10 and 12. So I was really concerned that where was I going to go? I kept getting bigger and bigger and bigger. Was I going to end up in a wheelchair? And if I did get into a wheelchair, was I ever going to get out of the wheelchair? And I had struggled for years trying to lose weight. I felt bad. I felt stupid. I felt this big. I felt like a lump. Every name I could call myself in the book that you could imagine, I called myself. When I looked in I didn't even feel human anymore. I felt like a thing. And that's when I knew I had to do something. I needed help. I did look at other hospitals, but Temple had, in my opinion, Temple had the better reputation for this particular surgery that I was looking for, which was the Roux-en-Y, gastric bypass. I really liked their hands-on care. I loved their personal touch. I wasn't just a number to them. I was actually a name and a face and a person. And when I got to meet Dr. Milan, he really cares about his patients. I was always waiting to see, okay, Mary, you stop losing weight. You stop losing weight. And in fact, that's one of the things I said to Dr. Milan. What happens if I plateau at 260? What are we going to do? And he looked at me. You're not going to plateau at 260. But if you do, we'll work with you, okay? We'll work with you. I'm not that fat person anymore. I'm Mary. I have a name. And my own perception is that I'm worth something. I like the person I am now. I didn't always like the person I was then. That is the biggest impact to me. It really is. If you need the surgery, get it. And this is the place to do it at Temple.